Before I explain common causes to the foot and ankle, I just want to run through the normal structures which are around the foot and ankle. And foot and ankle, we have got ligaments which are on the outer side, we call it the lateral side of the ankle, and the ligaments are on the medial side, which is inner side of the ankle. So there are three ligaments which are on the outer side of the ankle, which are commonly injured or sprained during sporting events like running, jumping, other sporting events like skiing and football, rugby. And the common cause for the ankle injuries is inversion, when the foot goes under. And the ligaments here, they are sprained. Sprains means they are not torn. A few fibers are ripped. That is called sprain, but they can, if the load continues, they can get completely torn. And sometimes one ligament is torn, or it is possible that you can have 2 or 3 ligaments which can be torn. And other sporting injury which occurs in the ankle is Achilles tendon. Achilles tendon is a band of muscle which starts from the calf and attaches to the heel, and it is an overuse injury, and with repetitive sporting activities like running and jumping. And again, it can be small tiny tears which can occur in Achilles tendon. They can cause tendonitis or tendinopathy, or it can rupture where it's completely torn. That is the second common cause of foot and ankle sporting injury. And third is stress fracture. What is the stress fracture? Stress fracture is when we are doing any physical activities, we are loading our muscles, and the muscles take the load and they are evenly distributed in the foot. But if the load is excessive and the muscle cannot take the load is transmitted to the bone, and the bone gives or develops a crack in the bone, and that is called stress fracture. And it is also an overuse sporting injury. And finally, if these injuries continues in the foot and ankle, and in the long term it can lead to an arthritis in the ankle. Treatment of the ankle injuries, first of all, ligament injuries, is an acute or we call it the first aid, which is a RICE, which is acronym for rest, ice, compression and elevation. Sooner it is started, better it is to recover from the acute injuries, because acute injuries can cause inflammation, and these RICE helps to reduce the inflammation down. And once the acute phase is over, which can take a couple of weeks, then it starts the physiotherapy. And physiotherapists, they focus on stretching. Because of the rest, the muscle goes they shorten the muscle, and it causes stiffness in the ankle. So that leads to stretching. Once the stretching phase is over, which takes about a week or so, and then comes strengthening. And they try to strengthen the muscles around the ankle so they can load in future in a sporting event. And finally, what's called balance or proprioception, that is also a part of a physiotherapy rehabilitation to bring the back balance again in the foot and ankle. So the whole recovery phase from the ankle sprains varies between 6 weeks to 12 weeks.